Hello, this is Dr. Irene Hausinger, and in this presentation we are going to go over the Washington State Treatment Guidelines. This information is taken directly from WAC 388-877. So what we will be doing is we will be going through each levels of care so that you can see what our state laws are in terms of what we have to do and what the guidelines are. So when we look at level of care, we are of course referring to the ASAM levels of care. Okay, so in level 1, we have outpatient services. So for each one here, I'm going to have which level of care we're referring to and then the WAC number. Okay, so outpatient services, level 1 is outpatient substance use disorder services. In ASAM Level 1 Outpatient Substance Use Disorder Services, we provide a program of individual and group counseling, education, and activities in accordance with the ASAM criteria. So here you have individual counseling, group counseling, and then the education part, which might be part of group, psychoeducation, etc. And activities refer to other activities that you would be participating in treatment. An agency has to be certified to provide level 1 outpatient substance use disorder. So they have to meet the Behavioral Health Agency licensure, certification, administration, personnel, and clinical requirements here. So one of the things that is important about this is that in 2018, the Department of Health took over the substance use disorder treatment and from DSHS. Previously, it was under the purview of DSHS. And so all the WACs changed and became condensed. And so previously, you had substance use disorder WACs in different places, and they weren't always included with behavioral health agencies. So now, all of them are in this chapter, and all of the WACs for any behavioral health agency are here as well. Okay, so it's much more organized currently. Okay, an agency certified to provide level 1 outpatient substance use disorder services have to have group therapy services with a staff ratio of 1 for 16 individuals. That changed in 2018. And a group counseling session with 12 to 16 youths includes a second staff member. So prior to 2018, you could have 12 clients to 1 counselor for adults. But now it's 16 adults to 1 counselor. And then for group counseling, if you have 12 to 16 youths, then you have to have another staff member in there. So this is relatively recent. Okay. Now we're going to look at level 2, outpatient services, which is intensive outpatient. Level 2 intensive outpatient substance use disorder services provide a concentrated program of individual and group counseling, education, activities in accordance with ASAM. I'm sorry, my parrot is making herself known. An agency certified to provide level 2 intensive outpatient treatment services must meet the Behavioral Health Agency licensure, certification, administration, personnel, and clinical requirements. Okay. We also have deferred prosecution, which is where somebody gets a DUI, they can potentially plead it down, and it's a 2-year program. And if they complete the 2-year program, then the DUI is not a DUI, it's reckless or neg, right? Ensure that individuals admitted under a deferred prosecution order receive services that meet the requirements of RCW, and here's the RCW number, including that the individual receives a minimum of 72 hours of treatment services within a maximum of 12 weeks, okay, which consists of the following during the first 4 weeks, which is your IOP. So basically, if you're in deferred prosecution and intensive outpatient, this is where the WAC tells us what we have to do. You have to have at least 3 sessions each week, with each session occurring on a separate day of the week, group sessions that must last at least 1 hour, and attendance at self-help groups in addition to the 72 hours of treatment services. So usually for IOP session, groups are 2 to 3 hours long. So that's 6 to 9 hours of group treatment a week. And you're also usually expected to go to 2 self-help meetings a week, maybe some other type of counseling as well. Sometimes they will substitute, if you're going to marriage counseling, then in addition to your IOP, then you might not have to do 2 self-help meetings like an AA or a Smart Recovery. You might just have to do 1 because that additional counseling can count. Right, so here's that attendance at self-help groups in addition to the 72 hours. One thing that I want to say here is, again, usually IOP is 3 days a week for 2 to 3 hours. Sometimes that could be more. It could be 4 days a week. It could be 5 days a week. Okay, and the ASAM gives us some flexibility in that. Okay. If you're doing deferred prosecution, there must be approval in writing by the court having jurisdiction in the case. Where there is any exception to the requirements, the agency must refer for ongoing treatment or support upon completion as necessary. So that's normal. This is what we do in a discharge summary. If the client has other things that might be helpful to them, then we write that and give referrals when they have graduated or are being discharged from treatment. All right, so here again we have group therapy has to have a staff ratio of 1 and 16, and then youth. Okay, so you're going to see some things that are repetitive here. Okay, so now we're looking at outpatient services. So outpatient is levels 0.5 through 2.1. So 0.5 would be prevention, something like the ADIS school. And then level 1 would be like weekly aftercare or monthly aftercare. Level 2.1, that's that intensive part, which is usually 12 weeks long. So you have 36 sessions, 3 times a week. No, 36 sessions total over the course of 12 weeks, which is 3 times a week at least. Okay. Substance use disorder assessment only services are provided to an individual to determine the individual's involvement with alcohol and other drugs. So you could just have a substance use disorder only service. Most agencies, though, most outpatient agencies are going to do assessment level 1 and level 2. But you might find some that are only doing assessments. A behavioral health agency certified for assessment only may choose to become certified to also provide DUI assessment services. An agency to provide assessment only services must meet the behavioral agency licensure, certification, etc. So here again we have a standard of care here. Okay. If they are doing assessment only, they have to review, evaluate, and document information. This is normal health stuff. May include information from external sources such as family support, individuals, legal entities, courts, and employers. And it's not required to meet the individual service plan requirements, because if you are only doing assessments, then you might not have actual treatment at your agency. You might just be an assessment agency that says, okay, this is the level of care you have. So this would make sense here, because if they don't have the capacity or the staff, or they don't offer that service, then they're not going to make an individual service plan. What they're going to do is give you a referral to other agencies that meet the level of care that you are recommended to have. Okay. So for a DUI, you're also going to usually have a police report. You might have an incident report. You'll usually read the judge's order and what the police officer had to say. And then maybe there's other documentation too. If there's a traffic incident, there might be other documents that you read as well. Okay. For substance use disorder assessment only services, an agency must maintain and provide a list of resources, including self-help groups and referral options that can be used by staff members to refer an individual to appropriate services. Okay. All right, same thing. Professional standards for behavioral health care offices. Okay. And all assessments have to be provided by a CDP or SUDP. You're going to see that that term CDP and SUDP synonymously. Okay, so now let's look at outpatient services, information and assistance services for substance use disorder services. This is general. Information and assistance services are considered non-treatment substance use disorder services provided to support an individual who has a need for interventions related to substance use. Information and assistance services require additional program-specific certification by the Department's Division of Behavioral Health and Recovery. It can include Alcohol and Drug Information School, Information and Crisis Services, Emergency Service Patrol, and Screening and Brief Intervention. Substance use disorder information and assistance services are available without an initial assessment or individual service and are not required to meet the other WAC requirements. An agency providing information and assistance services must maintain and provide a list of resources, including self-help groups and referral options that can be used. So you're seeing different tiers of agencies here, what they do and what they're required to do. So it would make sense that if it's not a treatment agency, it's more information, that they are going to have to give you a list of resources so that you could pursue additional treatment. Okay. Right. Alcohol and Drug Information School is 0.5 in the ASAM. It's early prevention. You're going to see this if maybe somebody gets a DUI, but it wasn't like a 0.08. It might have been a 0.04 or a 0.02, and they plead down to reckless or neg, but there's indication that they did break the law, and maybe there was a little bit of an accident or something. But this is kind of outside of no treatment. This is the lowest level of care that a person would get, and it's purely informational. The ADIS class is 8 hours, and basically it's pharmacology in a nutshell about this substance does this. This is what happens when you do this. These are the ramifications of this. These are the laws, etc. It's also very common for students that get a minor in possession for alcohol or marijuana, not a harder drug, but alcohol or marijuana, to have to take this class. Okay. And then the SBIRT, Screening and Brief Intervention, you can get trained in that through Washington State. There's also on the NADAC website as well, and it's a formal training on how to do the screening and brief intervention. And if you remember from the screening lecture, the purpose of screening is to see if a person needs to have an actual thorough assessment. So continuing, Alcohol and Drug Information School services provide an educational program about substance use. These services are for an individual referred by a court or other jurisdiction, such as a school, who may have been assessed and determined to not require treatment. In addition to meeting the requirements for substance use disorder information and assistance services, the agency has to ensure that the courses are taught by a certified information school instructor or by a CDP. And a lot of the community colleges around have taught these classes in the past, like TCC, where you can go and take the class and then become a certified instructor. And that's actually a really good side gig. If you are comfortable with giving up a Saturday every here and there, you can actually do quite well as a side gig teaching that class. So the Information School Instructor, or CDP, advises each student that there is no assumption that they have a use disorder. It's not therapy. It's an approved curriculum. There actually is a workbook for this, and ensures that each course has no fewer than 8 hours of classroom instruction, and administers each enrolled students in a post-test. So basically you sit through this class and then you take a multiple choice test and then you pass. Each enrolled student has the post-test for each course after the course is completed. If the person is not a CDP, that they have a certificate of completion from a training course, and again, these are offered at community colleges, ensure that each individual student has an intake form, including their demographics, the hours of attendance and dates, and a copy of the scored post-test. So this is just your basic documentation. Okay. Substance use disorder information and crisis services provide an individual assistance or guidance related to substance use disorders 24 hours a day by telephone or in person. So an example of this would be the Washington Help Recovery Line. You have this resource in Moodle. In addition to meeting the requirements, they have to have service available to any individual 24 hours a day. Each staff member has to have 40 hours of training that covers substance use disorders before they can man the phone line. And they either have to, in order to man this phone line, they have to be a CDP or a CDPT. And they have to maintain a current directory of all substance use disorder providers in the state and maintain a current list of the resources. So this is the best one that I know of, is the Washington Recovery Helpline. And sometimes they do hire. So if you maybe don't want to do direct service, but you're interested in doing something like this, then that could be a potential job. Okay. Emergency service patrol services provide transport assistance to an intoxicated individual in a public place when a request has been received from police, merchants, or other persons. In addition to meeting requirements, they have to make sure that there is a staff member providing the service, not just a random person. They have to have a Washington driver's license. They have to manually update their CPR, and that's normal for most health professions. You'll have to do CPR every year. Completed 40 hours of training in substance use disorder crisis intervention techniques and alcoholism and drug abuse to improve skills in handling crisis situations. Respond to calls from police, merchants, and other persons for assistance with an intoxicated individual in a public place. And the patrol assigned areas and give assistance to an individual who is in a public place. Okay. Conduct a preliminary screening of their condition related to the state of their impairment and presence of a physical condition if they need medical attention, and then bring them somewhere, to a home, a shelter, a treatment provider, maybe a hospital. Make reasonable efforts to take the individual into protective custody and transport the individual to an appropriate treatment or healthcare facility. And then call law enforcement if they're not going willingly. They have to have a log, the time and date of each call, time and arrival, the location of the individual, the sex of the individual, results of the screening, destination and address, and in case that they don't pick up a person, why did the person not be picked up? All right, now let's look at screening and brief intervention. Screening and brief intervention services are a combination of information assistance services designed to screen an individual for risk factors that appear to be related to substance use disorders, provide the interventions, and make appropriate referrals as needed. In addition to all the other requirements, they have to ensure that the services are provided by a CDP or a CDPT under the supervision of a CDP or another appropriately credentialed staff member. Ensure that each staff member completes 40 hours of training that covers substance use disorder screening and brief intervention techniques, motivational interviewing, referral, and maintain a current list of local resources for legal, employment, education, and interpreters and social health services. They have to make sure that the records contain the copy of a referral, demographic information, and documentation that they received the requirements under 42 CFR, which is the federal confidentiality. Documentation that the individual received a copy of the counselor disclosure information. Documentation that the individual received a copy of their rights, very similar to HIPAA. Authorization for the release, and a copy of screening documents. So this is something you can take this training through the Department of Health. And it might not be a bad idea to do that. Both NADAC and SAMHSA highly encourage that you have the SBRT training. Now let's look at the involuntary and court-ordered substance use counseling. In addition to meeting the Behavioral Health Agency, if we're doing involuntary, they have to have treatment during the first 60 days, weekly group or individual substance use disorder counseling sessions according to the individual service plan, which comes off of the assessment. One individual SUD counseling session of not less than 30 minutes, excluding the time taken for assessment for each individual according to the service plan. They have to have an alcohol and drug basic education for each individual, participation in self-help groups for an individual with a diagnosis of substance dependence. Participation must be documented in the individual's clinical record, and the balance of the 60-day time period for individuals who complete intensive inpatient substance use disorder treatment services must include, at minimum, weekly outpatient counseling sessions according to the ISP. Okay. So this is involuntary and court-ordered. So it's very similar to intensive inpatient, but they're saying that this is what you have to do within the first 60 days. Okay. And then the next 120 days of treatment, individual or substance abuse counseling sessions every 2 weeks, according to the ISP, one individual substance use disorder counseling session of no less than 30 minutes every 60 days. I really haven't seen very many 30-minute sessions. They're usually 50 minutes or an hour. Referral of each individual for ongoing treatment or support as necessary using ASAM criteria upon completion of 180 days of treatment. And for an individual who is assessed with insufficient evidence of a substance use disorder, a CDP can refer them to Alcohol Drug Information School or a lower level of care. Okay. Now let's look at somebody that's been court-ordered for a DUI. Driving under the influence assessment services are provided to an individual to determine their involvement with alcohol and drugs and determine the appropriate cause of care. Okay, so for a DUI assessment, they have to review, evaluate, and document information provided by the individual. If the individual doesn't have that information, then you need to sign a release of information and get that information from the court system where they had the infraction. That may include information such as family support, individuals, legal entities, courts, and employers. It's not required to meet the individual service plan requirements, and they must maintain and provide a list of resources, including the self-help groups and referral options. So again, we're seeing what we call a continuum of care in terms of resources. An agency certified to provide DUI assessment services must also make sure that the assessment is conducted in person and that the individual has a summary included in the assessment that evaluates the individual's BAC or blood alcohol level or other drug levels or documentation of the individual's refusal. So most likely this is going to be the police report or the hospital report, self-reported driving record, and the abstract of the individual's legal driving record. So what they said happened, but also you can get a driving abstract from the Department of Licensing. When the assessment findings do not result in a substance use disorder diagnosis, then the assessment has to include a copy of the police report, a copy of the court-originated criminal history, and the results of a UA or drug test obtained at the time of the assessment, and a referral to ADIS. So this is what I mentioned earlier. If you get a DUI, you're not doing nothing. At the very minimum, you are doing an alcohol drug information school. And this is a very, very common thing, especially during the summer and spring where people are experiencing allergies. They might take a Benadryl or an antihistamine and then have a couple drinks at a barbecue and then get pulled over because they're swerving or they're driving erratically, and they don't even realize it because of that potentiation. Right? Think about what antihistamines do and then think about what alcohol does, and it potentiates that. So they might have only had one or two drinks, so their BAC might be between a 0.02 and a 0.04, which is well below the legal limit, but they might get pulled over and arrested. And so this process is part of due process. Okay, so just because a person gets arrested for a DUI doesn't mean that the DUI is going to stick. It could be reckless or negligent driving. Okay, but the process is the same. They're going to go to court. They're going to have a drug and alcohol assessment, and you're going to still read all the documentation, and then you do a UA there when they come into the assessment. And this happens all of the time. So when you do assessments at an agency, you're going to really have a mixed bag of people that do have serious problems and then others that they don't. It could be a circumstantial thing like this. So they're going to do an assessment. They're going to do a UA. At the very least, they're going to do an ADIS, and they also have to do a victim impact panel, which is where they listen to somebody that their life was impacted by a DUI, and usually it's going to be somebody that lost a family member to a drunk driver, and then a person that was a drunk driver and caused an accident. So usually there's two speakers at those things. Okay. All right. So after the assessment, like with any assessment, you have to let them know what the results are and then refer them to the appropriate level of care according to the ASAM. Now we're going to look at opiate treatment programs, OTP, and many times you're going to see that OTP programs are combined with outpatient and inpatient. There are just OTP providers that just give Suboxone, or not give, prescribe Suboxone, oops, there's bias, or methadone or something like that. But usually there is case management involved, especially with a methadone clinic. Opiate treatment program services include the dispensing of an opioid treatment medication along with a comprehensive range of medical and rehabilitative services when clinically necessary to an individual to alleviate the adverse medical, psychological, or physical effects incident to opioid use disorder. This includes withdrawal management and maintenance. So withdrawal, helping somebody get off of it and mitigating those withdrawals, and then maintenance. Okay, so we still have those health care requirements here. They have to be licensed as a behavioral health agency. So this is important because it's not just medical. There is a behavioral health component here. They have to have policies and procedures to support and implement the general requirements and the program-specific requirements. And an agency providing OTP must ensure that the agency's individual record system complies with all federal and state reporting requirements relevant to opioid drug users. Okay. An agency must use the ASAM criteria for admission, continued services, and discharge planning. Provide education to each individual admitted, totaling no more than 50% of treatment services. Alcohol or other drugs and substance use disorder. So here's the education that they have to do. And this is true for the majority of treatments. A lot of this is done right in the beginning at the intake. So you have to give information on alcohol, drugs, and substance use disorder. Usually that's done in lecture format. You have to do information on relapse prevention. Usually that's done in a psychoeducation format where you discuss triggers and it's very personalized, and you might have a trigger group or do refusal skills. You have to give information on bloodborne pathogens. So that part of that is your HIV brief risk intervention screening that you've been practicing. You have to give information on tuberculosis. And in fact, if you're going to a treatment center or a jail or a hospital, you have to have a TB test before being admitted. And you have to give information on emotional, physical, and sexual abuse, nicotine use disorder, and the impact of substance use during pregnancy risks to the fetus, the importance of informing medical practitioners of substance use during pregnancy, and family planning. So a lot of this, so usually you have bloodborne pathogens and TB and nicotine. A lot of times that information is going to be presented at intake or admission to the facility. And the other stuff, relapse prevention information, abuse types, and FAS, FAE, fetal alcohol syndrome, fetal alcohol effect, those actually might be lecture or group topics that you're doing. Okay. But you really have to do this for everything. You do this for inpatient, outpatient, etc. Okay. Right. You must have written procedures for diversion control. So diversion is where it's going to one place and somebody takes it and puts it to a place where it's not intended for. So what would happen if somebody is going to your clinic for Suboxone or something like that and they're diverting the medication? And that actually doesn't happen too much. Yes, it happens. One of the arguments about prison is, well, people are just going to be selling their stuff. That only happens about 10% of the time. And OTP programs in prison are very, very effective, especially at reducing recidivism rates. So anywhere that you're doing a controlled medication or medication in general, you should be having a diversion control program, or what are the procedures that we're going to be doing. So you want to do your analysis and drug testing to see if the person's using other substances and also if they have the right amount of the substance that they're using. So lots of times UAs are used for monitoring what the substance is. So for example, let's say that you have a medical marijuana patient and their intention is not necessarily to get high or to switch drugs of choice, but let's say that they had an opiate problem and they're using medical marijuana because they legitimately have a pain issue. We would use UAs to see what their baseline of marijuana is, the concentration in the UA, and then we would also see, we would want to compare that to a journal that they have to keep to see, do you have a high pain day? Did you use more that day, etc. But it's a way to monitor to see if people are taking their medication in the way that they're supposed to be, or if they're not taking it, or if they're maybe taking too much, etc. So UAs can be used with different intentions. Right. So if you are on an OTP, they want you to have at least 8 UAs within 12 consecutive months. So almost every month. Random samples without notice. That's pretty standard for treatment. Samples in a therapeutic manner that minimizes falsification. So usually, many times you'll observe the UAs, but there's things that you can do to decrease the chance that it's going to be falsified. You observe the sample when clinically appropriate, and you handle the sample through a proper chain of custody and send it to a lab. For integrity's sake, usually, I would say that this is important. You want to send it to an outside lab for integrity's sake. There are treatment centers that do have their own labs, and a lot of people think that that is a conflict of interest, myself included. So you might be sending it to like Northwest Drug Labs or Sterling or a reputable lab where that's what they do. They do UAs. Okay, right. You're going to want to monitor the response to medical and psychiatric emergencies and verify the identity of the individual receiving treatment services so that there isn't fraud. Include maintaining a file with a photograph in the individual. Okay. That is pretty common, especially with inpatient treatment centers. You might have a picture with your file when you come in, and that's a couple things. It's really cool when a person leaves treatment, graduates treatment, and you show them their picture from the first day and they don't look anything like themselves, and it's only been 30 days, but now that they're healthier and they're eating, they look like a completely different person. So there's that. You can see how they change and how they grow, but also to reduce fraud. So somebody else claiming that they're the patient to get the medication is decreased. Okay. And an agency must ensure that an individual is not admitted to opioid treatment withdrawal management services more than 2 times in a 12-month period following admission to services. Okay. An agency providing services to pregnant women must have a written procedure to address specific issues regarding their pregnancy and prenatal care needs and to provide referral information to applicable resources. An agency providing youth opioid treatment services must have a written procedure to assess and refer the youth to the department's child welfare services when applicable. Ensure that a group counseling session with 12 to 16 youths has a second person there. Ensure that before admission, the youth has had 2 documented attempts at short-term withdrawal management or drug-free treatment within a 12-month period of time, with a waiting period of no less than 7 days between the first and second short-term withdrawal management treatment. And ensure that when a youth is admitted for a maintenance treatment, written consent by a parent or applicable legal guardian or responsible adult is obtained. So this is interesting. So usually they're not going to give you methadone or Suboxone or Subutex or something like that unless you have a history of use. So if you just started using maybe 3 months ago, they're probably not going to do that. They're probably going to want you to withdraw on your own. You wouldn't necessarily need maintenance at that point because you haven't been on it that much. I've heard some centers say that 7 months to a year would be the minimum that you've been on opiates that they would do maintenance for you. Otherwise, kind of just tough it out or do an ambulatory cocktail, etc. Okay. Right. So they wanted to see how severe have your withdrawals been? Do you actually need to do a maintenance treatment program? Okay. All right. An agency providing OTP must ensure that SAMHSA is notified within 3 weeks of any replacement or other change as a response to 42 CFR, which we're going to go to. Treatment is provided in compliance with 42 CFR. This is confidentiality standards. The individual record system complies with all federal and state reporting requirements relevant to opioid drugs, approved for use in treatments of opioid use disorder, and that if there is a death, it's reported within 1 business day. Okay, so things are really tracked very, very, very carefully. Okay, so let's look at withdrawal management services. So this could be detox, this could be ambulatory. Ambulatory means that it's in an outpatient setting, usually a PCP provider, where they might give you a detox cocktail. This only really works if you're supervised or if you have a support person to help you, somebody supportive in the house to make sure that you are taking that medication and not using your drug of choice. Substance use disorder withdrawal management services are provided to an individual to assist in the process of withdrawal from psychoactive substances in a safe and effective manner. Right. It must be a licensed Department of Health facility. It could be a hospital, like an ER or a hospital. It could be a private psychiatric and alcohol hospital, like Schick Shadle. It could be a private alcohol and substance use disorder hospital or residential treatment facility. And it has to be licensed by the Department of Health as a behavioral health agency, meet those criteria again, and have policies and procedures to support. Okay. They must use the ASAM criteria for admission, services, and discharge planning and decisions, provide counseling. So this is not just, oh, you're going to detox, here's a cocktail, sleep it off. No, they do a treatment plan. They're going to assess you. Do you need other levels of care? What are we going to do after detox? What are we going to do? Because this is just the first step. So they're going to provide counseling to each individual and look at why are you using, what's the motivation, what are your continuing care needs and need to referral. Maintain a list of resources and referral options that can be used to refer an individual to services. So again, we see that theme come here. Treatment is not an island. You always need other providers, and having a wide net of resources is really important. Post any rules and responsibilities for individuals receiving treatment, including information on potential use of increased motivation interventions or sanctions in a public place. Provide TB screenings. And here you go. Provide HIV/AIDS information and the brief risk intervention and a referral as indicated. So you have your risk ratings 1, 2, and 3. Ensure that each staff member providing withdrawal management services to an individual, with the exception of licensed staff and clinical chemical dependency professionals, completes a minimum of 40 hours of documented training before assigned individual care. This personal training must include substance use disorders, and infectious diseases. So there's your hepatitis and TB, withdrawal, screening, admission, and signs of trauma. Okay, so this person could be a CNA, it could be some type of assistant, it could be a medical assistant, it could be somebody that's hired specifically for that role. Okay. So in addition to your normal record keeping, you have to document the screening before they're admitted. So again, we have this flow of care. We're not going to admit people that don't need detox. So we need to make sure that they're screened, that they meet the criteria. A voluntary consent to treatment form or any release form signed and dated by the individual or their parent or legal guardian, unless they're in protective custody or have involuntary treatment. Okay, so involuntary treatment might mean that a police officer is admitting them, or a designated mental health professional, or a psychiatrist or doctor with admitting privileges. Documentation that they had the HIV/AIDS information and a BRI. And documentation that they had a discharge summary, including the continuing care recommendations and a description of the individual's physical condition within 7 days of discharge. So you're going to see here in the WAC that they give us time frames for how long we have to complete this. Okay. So let's look now, moving to residential. So what you see is that we started off with outpatient, and now we're moving towards inpatient. More specifically, residential treatment services provide substance use disorder treatment for an individual with in a facility with 24-hour-a-day supervision. Okay, so this, and now it tells us exactly what ASAM levels. It could be level 3.5, which is intensive inpatient, recovery house treatment services 3.1, long-term residential 3.1, youth residential 3.1, 3.5, 3.7. And agencies that are certified must be licensed. They have to have hospital licensing regulations because it's 24/7. Well, they have to be one of these. So there might be some differences here. It could be a hospital. So for example, Fairfax and Harborview and Valley Cities, they have detox programs that are treatment, and they might be a couple of weeks to a month or so. So it could look like you're at a hospital. So when we look at the ASAM, when we're looking at the dimensions, 3.7, 3.5, 3.1, what's differing there with the decimals is the level of medical care that we have. 3.7 is going to be a hospital type setting. 3.5 might not be medical care around the clock, but there's doctors and nurses there during the day or on call. 3.1 is usually less medical. Okay. It could be residential. They have to be licensed by the department as behavioral health agency. And again, here we have the same thing. Okay, right. And it's important, ASAM here is the golden standard of care. Okay, so here again, we have the minimum education and minimum information that they have to provide. So here we are in residential. We could be in a hospital. We could be in long-term sober care. We could be in intensive outpatient. You have to have information to the clients on substance use disorders, relapse prevention, bloodborne pathogens, TB, and provide education or information on emotional, physical, sexual abuse, nicotine use disorder, and the impact of substance use during pregnancy, risks to the fetus, etc. And then again, a list of sources and resources for self-help groups and referral options so that they can continue their care when they are out of your level of care. Okay. We're screening for prevention and control of tuberculosis. 16 individuals again. You have to have written procedures for UAs, drug testing, and including laboratory testing. How agency staff members respond to medical and psychiatric emergencies. The ISP is initiated with at least one goal identified by the individual during the initial assessment or at the first service session. I'm going to do that again. The individual service plan is initiated with at least one goal identified by the individual during the initial assessment or at the first service session following the assessment. Okay, and that might be like one of the common ones is lacks understanding on the disease progression of addiction, and that goal is usually met by attending lectures. So everything is kind of built in with it. If it's not already built into the treatment, then that's what you spend your time with for individual sessions. If you are an agency that provides services to a pregnant woman, so for example, the Harvest House program, and a lot of hospitals, they will specifically work with pregnant and parenting women. They have to have a written procedure to address those issues regarding the woman's pregnancy and prenatal care and provide referral information to applicable resources. That could be CPS. Right. An agency that provides an assessment to an individual must also meet the requirements for the DUI assessment provider. So it's basically the same thing. If you're doing assessments, you have to meet those criteria that we talked about earlier. Okay. Now let's look more specifically at intensive inpatient. Intensive inpatient services are substance use disorder residential treatment services that provide a concentrated program of individual and group counseling education and activities for an individual who has completed withdrawal management and the individual's family to assess overall functioning and to demonstrate aspects of recovery lifestyle. Okay, so here's the difference. You have detox, which is where the person is being flushed of what's in their system and stabilized medically, especially if they have co-occurring issues. Okay. So what this is saying is that they have to be fit. They have to be fit to go into intensive inpatient. Okay. Sometimes people are not medically stable and they have to be in the hospital for an extended period of time. So basically here we have that continuum of care stepping down from the most intensive level of care to a less intense level of care. Great. Okay, so if you're intensive inpatient, you have 5 days to complete the individual service plan. You have to conduct and document at least weekly one face-to-face individual substance use disorder counseling session. Progress notes must include the date, time, duration, participant names, and a brief summary of the session in the name of the staff member. So you know how to do this. That's the DAP note. Document at least weekly an individual service plan review, which determines continued stay needs and progress towards goals, and provide treatment services in line with ASAM. Okay, so when they come in, they do an assessment, and they have to have the individual service plan within 5 days. That's their treatment plan. While they're an inpatient, you see them once a week for a one-on-one. And usually they're doing group counseling every day except the weekends. Now let's look at recovery houses. And I want us to be careful about this because recovery house, that term, is not an even term. It can refer to a lot of different things. This is the WAC definition. Okay. Recovery house services are substance use disorder residential treatment. So that's important. It's not necessarily just sober living. Sometimes you're going to hear recovery house as sober living, which is basically just a house that's rented and everybody there is agreeing to be sober. And there might be some rules like Oxford House, etc. But this is actual treatment. That provides a program of care and treatment with social, vocational, and recreational activities to aid in individual adjustment to abstinence, relapse prevention, recovery skills development, and to aid in job training, employment, or participating in other types of community services. So here, we're seeing that the focus is less stabilization and more transition to being an active participant in society. We have this job training and employment aspect here. Okay. If you are in a recovery house, they have to have no less than 5 hours per week of treatment services in line with ASAM. You have to have the progress note. So again, it's exactly what you know how to do: time, date, duration, participant times, etc., participant names, what they did. Okay, and conduct and document an individual service plan review at least monthly. So with intensive inpatient, you're looking at it weekly. Here, you're looking at it monthly. Uh-oh. Okay, sorry about that. All right, so now let's look at the long-term treatment services. Long-term treatment services are substance use disorder residential treatment services that provide a program for an individual needing consistent structure over a longer period of time to develop and maintain abstinence, develop recovery skills, and to improve overall health. The Teen Challenge program would be an example of this. It's a year program. Betty Ford and Hazelden have longer-term programs like this as well. Okay. And I would say that CDRNR, they also are a longer-term program like that that's residential for at least a year or so. In addition to meeting the behavioral health requirements, here you have a minimum of 2 hours each week of individual or group counseling, and you have to have no less than 5 hours per week of treatment services, progress notes. Okay, and here we have a focus on educational and social coping skills, relapse prevention, and recovery skills development, social and recreational activities, assistance in seeking employment when appropriate, and assistance with entry living skills to include seeking and obtaining safe housing, and conduct and document an ISP at least monthly. So again, what you can see is this step down in the shift in focus of stabilizing drug treatment education to how are you going to live a sober life and get a job and go to school, etc. Okay. Now we're going to look at the residential substance use disorder treatment services for youth residential services. Youth residential services are substance use disorder residential treatment services that are provided to an individual 17 years of age or younger, according with ASAM. All right, so you have to have at least one adult staff member of each gender that's present or on call. I just want to, there's more than one gender. So if it is a treatment center that's serving LGBTQ, then we're going to want to be more sensitive to that and staff that appropriately. Ensure group counseling sessions with 12 to 16 youths, include a second staff member there. Ensure staff members are trained in safe and therapeutic techniques, including verbal de-escalation, crisis intervention, anger management, suicide assessment and intervention, conflict management and problem-solving skills like management of assaultive behavior, proper use of therapeutic physical intervention and techniques, emergency procedures, and provide group meetings to promote personal growth, provide leisure and other therapy or related activities, and provide 7 or more hours of structured recreation each week that is led or supervised by staff members like yoga, hiking, etc. Okay. Each youth, 1 or more hours a day, 5 days a week, has to have academic tutoring or instruction by a certified teacher if they're in treatment. Right? for more than 4 weeks. And then they basically have to do an education evaluation, obtain schoolwork from the individual school, or when applicable, provide schoolwork assignments consistent with the individual's academic level and functioning, conduct random and regular room checks when an individual is in the room and more often when clinically indicated, only admit youth with written permission of the youth's parent or, if applicable, legal guardian. In cases where the youth meets the requirements of CHINS, the youth may sign themselves into treatment. We will go over the what age you have to be in Washington to make decisions about your health. Okay. Assess the individual's need for referral to Department of Child Welfare Services if appropriate, and ensure if they're sharing a room that an individual 15 years of age or younger must not room with an individual 18 or older, and an individual 16 or 17 years of age must be evaluated for clinical appropriateness before being placed into a room with somebody that's 18 or older. We must have communication between the youth and the youth's parents, if applicable, or a legal guardian, and facilitate the communication when clinically appropriate. Notify the parent or legal guardian within 2 hours of any change in the status of the youth and document all notifications and attempts of notifications in the clinical record. So this is really important. And we talked about this with record keeping. If it's not in the file, it didn't happen. So even if you can't get through to the person that you're trying to, you have to document those attempts. You must. For emergency discharge, when the parent or legal guardian is not available, the agency must contact the appropriate authority to ensure each individual's clinical record contains any consent or release forms by the youth and their parent. So who is on the ROI, who can you talk to, who can you try to get a hold of, contains the parents or other referring person's agreement to participate in the treatment process as appropriate, and if possible, documents any problem identified in the specific youth assessment, including referrals to school and community support services or the ISP. All right, that is a lot. That's the most important parts. I'm going to create a little cheat sheet for you. I hope that this is helpful. I don't expect you to memorize all of this. You just need to know where to find it. Until next time.